Artificial Intelligence Dr. www.abcpharma.net/English. User question: why and how does a decline in cardiac output leads to severe hypotension, low blood pressure? The decline in cardiac output, particularly when associated with a condition like third-degree atrioventricular (AV) block, can lead to severe hypotension, low blood pressure, through several physiological mechanisms. 1. Reduced cardiac output. In cases of impaired cardiac function, such as third-degree AV block, where ventricular contractions occur independently of atrial contractions, the heart fails to pump an adequate volume of blood with each beat. This results in a decreased cardiac output, which is the amount of blood the heart pumps around the body each minute. 2. Hypotension. Reduced cardiac output means that the body's organs and tissues don't receive enough blood flow to meet their metabolic demands. This leads to a decrease in blood pressure, especially when the body is at rest or during periods of reduced physical activity. 3. Peripheral vasodilation. As a compensatory mechanism, the body might respond to decreased cardiac output by dilating peripheral blood vessels. This vasodilation reduces blood pressure further, as it redistributes blood flow to vital organs, such as the brain and heart, at the expense of other tissues. 4. Insufficient tissue perfusion. The decline in cardiac output and subsequent hypotension can result in inadequate blood perfusion to various organs and tissues. This can lead to organ dysfunction and ischemia, reduced blood supply, affecting everything from the brain and kidneys to the heart itself. 5. Cardiogenic shock. In severe cases, the drastic reduction in cardiac output can lead to cardiogenic shock, a life-threatening condition characterized by significantly low blood pressure and impaired organ perfusion. This requires immediate medical intervention. 6. Arterial hypotension. Low cardiac output results in reduced filling of the arteries between heart contractions, leading to decreased arterial blood pressure. 7. Baroreceptor response. The body's baroreceptors, pressure sensors in the heart and blood vessels, detect the drop in blood pressure. They respond by activating the sympathetic nervous system and releasing hormones like adrenaline to increase heart rate and constrict blood vessels, attempting to raise blood pressure. However, in cases of severe cardiac dysfunction, these compensatory mechanisms might be insufficient. 8. Impaired organ function. Hypotension can impair the function of vital organs, including the brain, kidneys, and heart. This can lead to symptoms like dizziness, confusion, kidney damage, and heart failure. 9. Shock. Prolonged and severe hypotension can lead to shock, a condition where the body's organs do not receive adequate blood flow, leading to organ dysfunction and failure. To manage severe hypotension resulting from decreased cardiac output, immediate medical attention is required. Treatments might involve intravenous fluid administration, medications to increase blood pressure, and, in some cases, the use of mechanical devices to support cardiac function, such as ventricular assist devices. The underlying cause, such as the third-degree AV block, would also need to be addressed.